Hello, I'm Dr. Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Welcome to this Q&A session. I'm going to share with you lots of questions that I'm often asked when patients are coming to have a consultation with me.
How can I get rid of my double chin?
So the dreaded double chin. Yes, we see quite a few patients who come in and they're really upset by the double chin. Often these are quite young patients as well. They might even be in their 20s and 30s. And genetically, they've had a fullness of the upper neck and there's excess fat underneath the chin in the neck, which is what we classify as the double chin. And it often feels like it's getting a bit worse with age because there's some skin laxity there, so it hangs forward. And it might be associated with weight. So obviously, if somebody has a significant double chin and they may be overweight, then one option would be to lose some weight and see if that helps. But often I find even if people lose weight, they retain that bit of fat underneath there. And so we need to do something about it. So there are lots of ways people do. I've seen in the past, we don't do them here for a good reason, but some people will be having injections of fat dissolving injections into the fat in the double chin. I don't do that because that is like putting petrol on the fire. It's uncontrollable. It causes a lot of inflammation, a lot of swelling. It may work, it may not work, it might even make the situation worse. But unfortunately, even if it destroys the fat, there's no skin tightening. So you're left with sort of more aging, loose skin. And at worst, it will cause a lot of inflammation that causes scarring. And it makes that fat go all hard and lumpy. That's why I don't like fat injections per se. Some people find it's quite effective to use cool or cryo treatment. So this is where you're freezing the fat to try to get rid of the fat, and that can work. It sometimes doesn't work very effectively in my experience, and often it will not leave any contraction of the skin. So again, you're left with that loose skin, even if the fat's gone, which is, again, people don't like that. So what do we use in Skin Excellence Clinics? Well, if you've got a significant double chin and a lot of excess fat there, then we like to destroy and remove that fat. And how do we do that? So we do a treatment called Bodyjet Bodyjet. And this is using the FaceTite probe. It's often called, now we call it NeckTite or JawTite, because not only can it destroy the fat that's in the double chin, it will tighten all the skin of the neck and along the jawline. So it's going to restore and give you much more of a defined jawline profile as the skin tightens above and below the jawline, as well as destroying the fat that's in the double chin and the skin tightening in that area. We actually suck the fat out as well, and that's where the Bodyjet system comes in. So the Bodyjet is a way of infiltrating the area with anesthesia very effectively. It's like a jet wash of spray of anesthetic into the tissue, so therefore we can anesthetize very quickly and painlessly with the Bodyjet system. And then once we've done the heating effect with the FaceTite probe or the AccuTite probe in that area, which actually will destroy some of the fat and tighten the skin, we can then suck out that sort of destroyed fat at the end with the Bodyjet system. So this is a unique system that we're using, whereby we can destroy fat, we can suck it out, and we can tighten the skin at the same time. That's called, and that's our dual procedure. That's probably the most effective way that we have in clinic. There is a bit of a recovery period from this treatment, but most people recover very quickly. There's minimal, tiny little holes where these probes go in, so we're not usually troubled by any scarring or problems that you might get with a more surgical approach. If you're having liposuction or even neck skin tightening, then that's much more of a surgical. This is a sort of mini surgical procedure. In less severe cases where you may have less fat or a small amount of fat causing you double chin and minimal laxity, then actually you may not need the full FaceTite Bodyjet procedure, and actually a Morphis 8, which is radio frequency microneedling, may well help to destroy some of that fat superficially underneath the skin and tighten the skin. And usually 2 or 3 sessions of Morphis 8 can address those lesser cases where you've got a little bit of a double chin and a little bit of laxity, but it's not too bad. But certainly the ones that have got quite significant fat and a double chin, then we find the only way to do it is to actually destroy the fat, suck it out, and tighten that skin quite significantly to get a good result that is then long-lasting. We're talking years and years and years.